Have you ever imagined waking up one morning to realize your lower extremities are bilaterally paralyzed due to weakness? Believe it or not, this nightmare is real and affects 3,000 to 6,000 Americans each year. Hi, my name is Eddie Diaz, and together with my group of fellow nursing students, we're going to be presenting Guillain-Barré syndrome and myasthenia gravis, both problems of the peripheral nervous system.
Guillain-Barré is an acute inflammatory syndrome that affects the axons and myelin of the peripheral nervous system, causing motor weakness and abnormalities in sensory perception.
Good morning, Mr. Miguelina. How do you feel? You feel bad? Okay, let me bring you the wheelchair, okay? Wait a minute.
Segmental demyelination destruction slows the transmission of impulse from node to node, damage of the motor neurons, resulting weakness and damage of the sensory nerve, send forward message to the brain, affecting the patient's sensory perceptions.
How are you? What does it bring you today?
Very bad. I feel horrible, doctor. I can walk.
Oh, I can see why you're in a wheelchair. What happened to you?
I feel very tired. I feel die. I feel tired. I fall in my bathroom last night. I don't have a good vision. I don't know what happened to me.
Okay, so let me ask you something. When do you start feeling like this?
I don't know, 1 week. I don't have. No tengo fuerza, doctor. No tengo fuerza en las manos. My muscles are.
But what specific part of your body starting these symptoms?
The legs. Horrible.
So you can walk because you have uncoordinated movement.
I have uncoordinated movement, and when I think I want to have a movement, it doesn't happen.
Okay.
I don't know.
So have you ever checked your blood pressure or your sugar
My
level?
I feel terrible. I think my blood pressure is down.
Okay, I'm gonna run some tests on you. The following diagnostic tests may be done: cerebrospinal fluid sample, EKG, electromyography, nerve conduction velocity, and pulmonary function test. Obtain a complete health history and assessment. Ask the patient to describe symptoms in chronologic order is possible. Inquire about the presence of pain, numbness, and paresthesias. Miguelina, here we have all the results are positive to Guillain-Barré syndrome. So the patient may receive either plasma exchange, also known as a plasmapheresis, or IV immunoglobulin.
Nursing interventions include provide information and take care of patients while on plasmapheresis and during the infuse of IV immunoglobulin. Nurses have to weigh the patient before and after the plasmapheresis and care of the venous access site. Also give the IV immunoglobulin slowly and increase the rate based on the patient's tolerance. To promote airway patency and adequate gas exchange, nurses need to implement aspiration precautions that include elevating the head of bed to 45 degrees or higher. Also assess cognitive status, especially in older adults, because a decline in mental status often indicates hypoxia. Monitor vital signs closely and report any change in heart rate and blood pressure to the healthcare provider immediately is very important. Also, to prevent thrombophlebitis, apply antiembolics, stockings, or compression boots, and give prophylactic anticoagulants as ordered. To prevent aspiration, test for dysphagia prior to restarting oral drugs or nutrition, and encourage coughing and deep breathing. We may need to use an incentive spirometer to prevent pneumonia or atelectasis. Oxygen may be administered by nasal cannula at a flow rate prescribed by the healthcare provider. To improve mobility and prevent complications, assess the patient muscle strength every 2 hours. To ensure safety, assist the patient with walking, transferring from bed to chair, and position changes. Perform active or passive range of motion exercise at least daily. Monitor fatigue level and provide adequate rest periods between activities. Assess skin integrity at least daily because of the risk of pressure ulcer. Administer medication as authorized, such as analgesics to relieve muscle stiffness and spasms, and opioid for pain management. To provide other pain control measures include massage, ice, heat, relaxation techniques, hypnosis, and distraction like music and visitors. To promote communication, collaborate with a speech-language pathologist. A simple technique involves eye blinking or moving a finger to indicate yes or no. Provide emotional support to the patient and her family. Encourage the patient to verbalize feelings about the illness and its effects, if possible, while fostering hope.